foramen. Yes, foramen. And this area is named cervical canal. Okay, cervical canal. The fundus is completely covered by peritoneum. Okay. Look at here. The fundus completely covered by the peritoneum. And also, you know that the uterus is reflexed anteriorly and attached to the fundus of the bladder. Okay? The body, look at the body. The body also is covered by the peritoneum. Body of uterus has two surface and two border. Anterior surface of body is adjacent to bladder. Posterior surface of body is intraperitoneal and adjacent to no. Look at here. Look at here. It's this part. This part is cervical canal. It's not the body. The body at the posterior surface is adjacent to the sigmoid and ileum. Okay? Sigmoid and ileum are located in the Douglas pouch and are adjacent of the posterior surface of the body. The lateral border. If If I want to show the lateral border of the body, okay, I say that if this was the lateral border, I say that at the site of attaching the body to the fundus, here I have a foramen. This is the site of attaching which part? In the lateral border. Fallopian tube. Yes. Here is fallopian tube. It is anterior, posterior. Fallopian tube in the infero-anterior and infero-posterior has the site of attachment of two structures. Okay? Infero-anterior, it is lateral border, and infero-posterior. Here is the site of attachment of round ligament of uterus, and infero-posterior is the site of attachment of ligament of ovary. Okay? Ligament of ovary, uterine tube, round ligament of uterus. This structure attached to lateral border of the uterus. Another part is the cervix. If the cervix in the sagittal section, look at this, it is sagittal section, yes? The cervix has a canal which is named cervical canal, which is seen like a fissure, okay? But in the coronal section, if I have a coronal section, the cervical canal is seen like a triangle, which the apex is located in the superior part. The cervix also has anterior surface and posterior surface. Anterior surface of the cervix is adjacent to bladder. Anterior surface has two parts, okay? If it was, okay, here and here. Anterior surface has two parts. This part and here. Here is bladder, okay? This part is covered by peritoneum. It is the site of the peritoneum, but inferior part does not covered by peritoneum. So I can say that anterior surface of the body has intraperitoneal part and retroperitoneal part. Posterior surface of the body, look at the posterior surface, made anterior border of Douglas pouch. Yes? Here I have the rectum. So I can say that posterior border of the cervix is completely intraperitoneal organ. It is completely covered by peritoneum and made anterior border of Douglas pouch. Okay? Where is the isthmus? Here, when the cervix attached to the body, okay, we have a restricted area. This restricted area is located at the level of internal os. It is named isthmus of the uterus. The uterus has two parts of ligaments. One of the ligaments are derived from the peritoneum, but another ligaments are derived from the endopelvic fascia. You know that all of your body cavity is covered by the fascia, yes? For example, the body cavity is divided into parts, thorax, abdomen. The fascia in the thorax is named endothoracic fascia, yes? The fascia in the abdomen, superiorly is named diaphragmatic fascia. Anterolaterally is named transversalis fascia. In the pelvic is named iliacus fascia. Yes, all of this area are covered by the fascia. So, the thickness of the fascia in some area made some ligament. They are a strong ligament for the uterus. But also, some of the ligaments of uterus are peritoneal, like broad ligament. Broad ligament is two layers of peritoneum. It is a peritoneal ligament. I have three peritoneal ligaments. Broad ligament attached to lateral part of the uterus. Anterior ligament and posterior ligament. Anterior ligament is this ligament. This is anterior ligament here. Okay, this ligament. This is when two layers of peritoneum attached together. What is the name of this ligament? Vesico-uterine. Okay, between bladder and uterine, it is named vesico-uterine ligament. Posterior ligament. Here. When these two layers attached together, recto-uterine. Vesico-uterine, recto-uterine. Two layers of peritoneum attached together and made peritoneal ligament, or also these ligaments are named false ligament because they are not strong ligaments. Yes, they are named false ligaments. Another ligament of the uterus are derived from endopelvic fascia, or they are fibromuscular ligaments. For example, round ligament of uterus, which attached to lateral border of the uterus at the level of fundus and body, and travel laterally and arrive to the inguinal canal of the female. After inguinal canal, exit from the external ring, and the fiber of this ligament are spread and arrive to the labia majora of the female. Okay? So, this is a fibromuscular ligament. It is named round ligament of uterus. Look at here. In the lateral part, travel laterally. Okay? Here we have inguinal canal. Yes? So, travel laterally to insert to inguinal canal, exit from external vein, okay? And here, if labia majora of the female, they spread in the labia majora, okay? It is the root of the round ligament. Another ligament are derived from endopelvic fascia. Look at here. Look at here. It is the fascia of the endopelvic area. The first, one of the ligaments originate from the pubic bone or pubic symphysis, travel posteriorly to arrive to the cervix of the uterus. They are named pubocervical. Okay? Look at here. They are pubocervical here. This thick area of the endopelvic fascia from pubic bone to cervix. It is named pubocervical. Pubocervical are equivalent to puboprostatic. What are puboprostatic? Puboprostatic in the male attach the pubic bone to the anterior surface of prostate. Okay? Equivalent of puboprostatic is pubocervical. Another is uterosacral. Look at here. Look at here. It is uterosacral. It attached the cervix of the uterus to the periostome of the sacral bone. It is named uterosacral ligament. It is thickness of the endopelvic fascia. Another fascia is located transversally or horizontally. Okay? Here, here, and here. It is named lateral sacral ligament. Okay? Lateral sacral ligament, or also is named cardinal ligament, which attach the cervix of the uterus to the pelvic fascia, which covers the pelvic cavity in the lateral part. These four ligaments are categorized as true ligaments of the uterus. And we have three false ligaments which are derived from peritoneum. What is the function of this ligament?
Supports the uterus.
Yes, supporters for the uterus. It is a function of every ligament. But also, because the uterus carry the baby during pregnancy, it should have another supportness. Okay? Because the baby made a weight in the uterus. If we don't have another supportness, maybe the uterus falling down and made prolapse of the uterus. What are another? The most important supportness is the angle of the uterus. Okay? As you know, the vagina, which I say the vagina in this area. The vagina is a fibromuscular tube which originates in the inferior part in the vulva and travel superior and posteriorly to arrive to the cervix of the uterus. Okay? So, the vagina when arrive to uterus, yeah. Okay? When the vagina arrives to uterus, make a circular groove around the external os of the uterus. This circular groove is divided anatomically in 4 parts: anterior, posterior, and 2 lateral parts. Every of these parts are named as fornix. Okay? So, every of these parts are named as fornix. Posterior fornix is deeper than another. Okay? It is posterior fornix. And another fornix are located circularly around this area. This is the axis of the uterus of the vagina. This is the axis of the cervix, and also this is the axis of the body. Okay, we have 2 angles. One angle is located between the axis of the vagina and the axis of cervix. This is about 90 degrees and is named anteversion. Okay, it is named anteversion angle. Another angle is located between the axis of the cervix and the axis of the body. It is about 120 degrees. Okay? It is when the body of the uterus is flexed on the fundus of the bladder. It is named anteflexion. Or remember, anteversion, V vagina. Okay? Anteversion, V vagina, between vagina and cervix. Anteflexion, when the body is flexed on the fundus. Okay? They make a supportness for the uterus. Another supporting part are pelvic diaphragm, because if we have any weakness in the pelvic diaphragm, maybe we have prolapse of the uterus. Another supporting part is perineal membrane. Perineal body. Perineal body is a dense fibromuscular area which is located in the central part in the perineum. I say you in the topic of the perineum. And the sphincter mechanism of the urethra also, it is in the perineum, I say you. What is the blood supply of uterus?
Uterine artery.
Yes, uterine artery and ovarian artery. Because uterine and ovary are anastomosis together. If we cut the uterine artery, the ovarian artery can replace it. The venous draining is the same. What about the lymphatic draining?
Shouldn't it drain also like penis to the pre and para-aortic lymph node?
Hush. Here, the fundus. Here we have the fundus. Okay. Another area in this part. The body and the cervix. The fundus and the most part of the body, its lymphatic vessels drain to pre and para aortic lymph nodes. Okay? Here, the cervix. Okay? The cervix and inferior part of the body. This area is the body. Okay? This is the inner box. This is the body. So, the cervix and inferior part of the body drain to external iliac nodes. And this part, which is located near the site of attachment of the round ligament attached to, drain to superficial inguinal nodes. And also, if you remember, I said that medial part of the fallopian tube also drain to superficial inguinal node. Why? Because this area is located near the round ligament, and the lymphatic vessels beyond around the round ligament travel to arrive to inguinal node, because round ligament attached to labia majora in the female. Yes, so the lymphatic vessels of this area and also lymphatic vessels of the medial part of the fallopian tube drain to superficial inguinal nodes.
From the round ligament, from the inguinal region, the lymph node travel and around the round ligament and reach to the uterus.
No, this lymphatic vessel just travel around the round ligament.
Yes, yes, yes.
Okay. Okay. The vagina. I talked about the vagina, but the adjacency. Look at here. The vagina has anterior surface, posterior surface, and two lateral surface. Anterior surface is adjacent to bladder and urethra. Yes. Posterior surface. Look at here. Posterior surface is adjacent to three parts. Three parts. Okay? Here. Here is we have the vagina. This area of the vagina, okay, internal os, external os, and is the vagina. This area is adjacent to Douglas pouch. Okay, superior part is adjacent to Douglas pouch. Douglas pouch. This part is adjacent to rectum. Yes, middle part adjacent to rectum. Inferior part. In the inferior part we have pelvic diagram. Yes. Here we have pelvic diagram. So in this part, it is adjacent to anal canal. Yes. And between anal canal and vagina, here we have a dense fibromuscular tissue which is named perineal body. Perineal body. Okay. They are posterior, adjacent of the vagina. What about the lateral adjacent? Look at here. It is lateral adjacent of the vagina. This section is a coronal section. In the coronal section, here is the pelvic floor. They are levator ani muscles. Yes? They are levator ani muscle. And this is the vagina in the lateral surface. The vagina in the lateral surface is adjacent to this ligament. What was this ligament?
Transverse something.
Transverse cervical, okay, or cardinal ligament, okay. Transverse cervical or cardinal ligament is located in this area. Also, in the transverse cervical ligament, we have uterus and uterine artery, which they are very near and close together in this area. The uterine artery is a branch of internal iliac artery, which it is located in the retroperitoneal and travel medially to arrive to the cervix. Look at here, it is uterine artery. Travel medially to arrive to the cervix. When arrive to the cervix, insert to the broad ligament, okay, and travel superiorly. Also, in this area, we have the ureter. Which ureter in the endopelvic fascia? Ureter is a retroperitoneal, yes? In the endopelvic fascia, travel inferiorly to arrive to bladder. In this area, they are located very near together and they are adjacent of the superior part of the vagina and also inferior part of the cervix of the uterus. Okay? It was adjacency of the lateral part in the superior part. In the middle part, it is adjacent to levator ani muscle. Okay? Levator ani muscle is adjacent to the medial part of lateral surface. In the inferior part, the vagina, in the inferior part, and laterally is adjacent to this structure. The structure which are located in the perineum. Which structure? Here and here. Bulb of vestibule, yes. The muscle which covers bulb of vestibule, which is named bulbococcygis, and a duct of the, look at here, a duct which is some part of the greater vestibular gland. Okay? These three structures are lateral adjacency of the inferior part of the vagina. Okay? During pervaginal digital examination, you can touch some structures which are adjacency of the vagina. For example, if we have accumulation of the pus in the peritoneal cavity, okay, this pus is located in the more inferior part. Where is the most inferior part? Douglas bulge. So, I say that posterior adjacency of the vagina is Douglas bulge. So, if we do colpotomy, what is colpus? Yes. Colpus is another name of the vagina. If we do colpotomy, we can drain the pus in the Douglas bulge through the vagina. Okay? Another structure, we can touch the rectum through pervaginal examination. Anteriorly, you can touch bladder, urethra. Laterally, in the lateral part, you can touch also inferior pole of the ovaries. Okay? You can touch the cervix. Because I said that here we have fornix. If you insert your finger in the fornix of the vagina during vaginal examination, you can touch the cervix of the uterus. In this area, inferiorly and laterally, you can touch the duct of the greater vestibular gland. Yes? What is cystocele and rectocele? Cystocele and rectocele are occur when you have prolapse of the uterus. If we have prolapse of the uterus and the anterior adjacent of the uterus, anterior adjacent of the vagina, okay, by the vagina travel downwardly, okay, we have the cystocele because the bladder can falling down, okay, bladder can falling down, which is named cystocele. If urethra is falling down, it is named uretrocele. If posteriorly, the rectum, because rectum is adjacent of the posterior wall of the vagina, okay? If the rectum is falling down, it is named rectocele. Yes. The final topic is the pollen dome. vulva, pudendum, or also is named external genitalia, are the external genital organs of the female which are located in the perineum. This structure, the perineum, are superiorly is the mons pubis. Mons pubis is the accumulation of the fat which is covered by the skin. It is located at the anterior part of the pubic symphysis. Laterally is the labia majora. Labia majora are the folds of the skin which also contains sebaceous gland in this area. Labia majora anteriorly I cut the mons pubis. Labia majora anteriorly attached together, okay, and in this area made anterior commissure, okay, anterior commissure, and also posteriorly attached together and made, yes, posterior commissure. Here if we have the anus, yes, posteriorly we have the anus. This area between posterior commissure and anus is named gynecological perineum. Gynecological perineum, this area. Medial to labia majora, you can see the labia minor. Labia minora medially are covered by the mucosa, and also labia minora at the posterior part attached together and make labial frenulum. Labial frenulum. Labial frenulum is also named fourchette or labial frenulum is the attaching of the posterior part of the labia minora. Anteriorly, here we have the glands of clitoris. Okay, the clitoris is a erectile organ in the female, which clitoris is made by the two corpus cavernosum. Clitoris does not have corpus spongiosum. Okay, it just contains corpus cavernosum, which corpus cavernosum attached together and make the body of clitoris. But glands of clitoris is made by the ball of vestibule. Okay? When labia minora attached to clitoris, attached to glands of clitoris, are bifurcated and made two parts. Inferiorly made the frenulum of clitoris. Superiorly made the prepuce of clitoris. Okay? Superiorly made the prepuce of the clitoris. This area which is located between two labia minora is vestibule. Okay? Or vulva. Vestibule or vulva, which the structure which is located in this area. Which structure?
Clitoris.
From anterior to posterior. Mons pubis, anterior commissure, yes?
Clitoris.
Clitoris. After clitoris here, urethra, yes. External urethral orifice. After external urethral orifice, yes, vagina here. which vagina in this area is covered by a mucosal membrane which is named hymen. Okay? The mucosal membrane which covers the vagina in this area which is named hymen is located in this area. Lateral to vagina, we have duct of greater vestibular gland. Duct of greater vestibular gland in this area are located. So, this was the external genitalia. Also, look at this slide in the external genitalia. Mons pubis. Mons pubis, after mons pubis, here is the clitoris. Clitoris superiorly is covered by the prepuce, inferiorly is covered by the frenulum of the clitoris. Then you can see the external urethral orifice, the vagina which is covered by the hymen, these two ducts which are named duct of greater vestibular gland. Here is the fourchette which is the site of the attachment of the labia minora. Here is the posterior commissure, and this area between anus and between the posterior commissure is named yes, gynecological penile. Do you have a question?
No.
No? Okay.